So when you're in the process of treating and assessing why the patient is here to see you, can you differentiate between actual psychiatric conditions and then those attributed to Lyme disease or any vector-borne disease?
I mean, oftentimes it's almost impossible, obviously, to tell. One of the things that can kind of make it easier is obviously if you have a known like tick attachment, like if you're otherwise well and then you find the tick or you find the rash and within a few weeks all of the symptoms start, that's easy because you know, like, okay, like we're pretty certain that this, all of what you're experiencing now is directly related on the timeline to the tick, right? Most of the time, we don't have an easy answer like that. Where it gets complicated, and I see this a lot because I see kids, is that we see people presenting with psychiatric symptoms around the same developmental time where we normally see psychiatric symptoms presenting. So, for example, anxiety, ADHD, this can be like, in your childhood years, like your earlier childhood years. But that's the same time where people can also get infections. So that's where it gets kind of tricky. Like if you have a 40-year-old woman who presents to you, she's never had any medical problems, she's never had any psychiatric symptoms. She just moved to a house in the woods and now she develops a complex like smattering of medical and psychiatric symptoms. That's kind of a slam dunk case too, because she's out of the window that we normally see psychiatric symptoms developing and she was otherwise good and then all of a sudden has these new onset psych symptoms. So that's like I would put a big bet on that that's all infection related, but oftentimes we don't know entirely. I have to explain to them like, listen, these are the reasons why I think it might be infection related. You also have positive testing. You have these symptoms that are suggestive of it, but we don't really know for sure and until we go down the treatment road and we see improvement. And by the way, it's not that we start one thing and we automatically see improvement. We might need to like change up the antibiotic regimen, for example. It just kind of depends also on the infection that we're dealing with.